Welcome students. Today we will be talking about maternal health issues and concerns. Maternal health is something which is much discussed in today's scenario. Across the world, especially in countries, developing countries like India, maternal health is an issue which is talked about much. It's an issue of concern. Motherhood should be a joyful experience, it should be a positive experience. But for many women across the world, pregnancy and childbirth are a dangerous and frightening experience in their life. Both times are giving them a lot of trouble. Illness, injury, or even death of the mothers as a result of complications during pregnancy, during childbirth, or soon afterwards, after the delivery, are all too common now. Most of the injuries and deaths that we are worried about, that we have been talking about, are preventable, provided the women have necessary information, quality health care, and family as well as community support. So today's lesson objectives are to discuss the issues concerning this maternal health that I have been talking about, and how and what are the issues related to maternal health during pregnancy and the various concerns around it, and maternal health after childbirth, the risks and the possible interventions. Let's talk a little more about this concept of maternal health. It is the health of a woman during pregnancy, childbirth, and during postpartum period as well. Now, it encompasses the healthcare dimensions of family planning, preconception, prenatal, postnatal. In order to reduce maternal morbidity and mortality, what all can be done? All these issues are discussed under the major head of maternal health. The United Nations Population Fund, which we in short call UNFPA, estimated that 289,000 women died of pregnancy or childbirth related causes in 2013. Alarming? The number sounds alarming. These causes range from severe bleeding to obstructed labor, all of which do have very effective interventions if planned properly. As women have gained access to family planning and skilled birth attendants with backup emergency obstetric care, the global mortality ratio has fallen from 380 maternal deaths every 100,000 live births, this was in 1990, to 210 deaths for 100,000 live births in 2013. You see that there has been a steep decrease. This has resulted in many countries lowering their maternal death rates. Let's start with maternal health during pregnancy. Complications of pregnancy are health problems which a lady faces, which a woman faces during pregnancy. They can involve the mother's health, the baby's health, or both the mother as well as the baby's health. Some women have health problems which arise during pregnancy, and other women may face health problems before they become pregnant, and either could lead to several complications. It's very important for women to receive health care before and during pregnancy to decrease the risk of pregnancy complications. The pregnancy symptoms and complications may range from mild to really annoying discomforts to severe, sometimes life-threatening diseases as well. Sometimes it can be difficult for a woman to determine which symptoms are normal and which are not normal. Problems during pregnancy may include physical problems, they may include psychological problems which affect the health of the mother or the health of baby as well. There may be certain physical health problems, those ranging from anemia to urinary tract infection, which might go undetected, and several other infections, mental health conditions like depression which may not be understood by many, and in addition to this there may be psychophysiological problems, and even these problems are not really uncommon. We have to keep in mind that there are ways to manage problems which might come up during pregnancy. Poverty, malnutrition, substance abuse, all these may contribute to impaired cognitive, motor and behavioral problems across childhood if proper care is not taken during pregnancy. In other words, if a mother is not having optimal health during the prenatal period is the time while she is pregnant. If the fetus is exposed to some teratogens, then the child is very likely to experience health or developmental difficulties, or the child may experience both. The environment which the mother provides to the embryo or the fetus is very important for its well-being even after gestation and birth. It has long-term effects. Let's now focus upon certain problems which are troublesome and which cause distress to women in particular. Let's start with infertility. Remember, we said even before conception there might be problems. We will start with infertility. Some 15% of the couples, according to studies, suffer from infertility and the inability to conceive even after 12 to 15 months of their attempts to conceive. The older the parents, the more likely the infertility. For women, the most common cause of infertility is failure to release egg through ovulation. This may occur because of a hormonal imbalance or a damaged fallopian tube or uterus, or it may be due to certain stresses or abuse of alcohol or drugs. Poverty and lack of access to health care can be very problematic to a woman. According to UNFPA, a woman's chance of dying or becoming disabled during pregnancy and childbirth is closely connected to her social and economic status, the norms and the values of her culture, and the geographic remoteness of her home. Poverty, maternal health and outcomes for the child are all interconnected. One is connected to the other. Neonatal deaths in developing countries are supposed to account for 98% of worldwide yearly neonatal deaths. A study which was conducted in Kenya observed that common maternal health problems in poverty-stricken areas include hemorrhaging, anemia, hypertension, malaria, placenta retention, premature labor, prolonged or complicated labor, and many others. Generally, adequate prenatal care encompasses medical care and educational, social, as well as nutritional services during pregnancy for a woman. Income is strongly correlated. We have been talking about this again and again. It's strongly correlated with the quality of neonatal care. Sometimes proximity to the healthcare facilities and access to transportation have significant effects on whether or not a woman has access to prenatal care. Research indicates that women who lived in rural areas far away from healthcare facilities were less likely to receive prenatal care than those who lived in urban areas where access to healthcare facilities is closer and easier. Furthermore, the researchers also found an even stronger relationship between lack of transportation and prenatal as well as delivery care. What contributes to mother's health then? Depending upon when it strikes, an illness in a pregnant woman can have devastating consequences both to the mother as well as the child. For instance, the onset of what is called rubella, commonly called as German measles, before the 11th week of pregnancy can cause blindness, can cause deafness, heart defects or brain damage in the baby. Several other diseases may affect a developing fetus depending upon when they are contracted. For instance, chickenpox may produce certain birth defects, while mumps may increase the risk of miscarriage. Some sexually transmitted diseases, STDs, such as syphilis, can be transmitted directly to the fetus, who will be born with the disease. Some other STDs like gonorrhea are communicated to the child as it passes through the birth canal to be born. mothers who have AIDS, acquired immunodeficiency syndrome, or who are carriers of the virus may pass it on to the fetus through the blood that reaches the placenta. However, if the mothers with AIDS are treated with antiviral drugs during pregnancy, less than 5% of the infants are born with the disease. A little more about this HIV/AIDS. Maternal HIV rates vary around the world, ranging from 1% to 40%, with African and Asian countries having the highest rates among these. Although HIV or AIDS can be transmitted to the offspring by the mother at different time, the most common time that mothers pass on the virus is during pregnancy. During the perinatal period, the embryo or the fetus can contact the virus through the placenta, as mentioned already. And during pregnancy, there is a risk that a mother will pass on the virus to the offspring if she does not receive proper treatment, if she is infected by HIV or AIDS virus. On the other hand, if she is treated, then there is a far higher chance that her baby will not become infected. Having HIV or AIDS while pregnant can also cause heightened health risk, not only for the baby as discussed so far, but also for the mother as well. Now, yet another aspect that we need to discuss is obesity and weight gain. Gestational weight gain should typically fall between 11 to 20 pounds in order to improve the outcomes for both the mother as well as the child. Recent studies suggest that the heavier a woman is before she becomes pregnant, the greater her risk of pregnancy complications, including preeclampsia, gestational diabetes, stillbirth, and cesarean delivery. Increased rates of hypertension, diabetes, respiratory complications, and infections are prevalent in cases of maternal obesity, as discussed, and can have detrimental effect upon both the pregnancy as well as the childbirth and on the child as well. Let's talk about this present day demon, which is discussed a lot, gestational diabetes mellitus, GDM in short. Let us discuss a little more about the present day problem, which is discussed much all over the world, more so in India. And in pregnant women, when this problem is seen, then there is a cause for concern. It is gestational diabetes mellitus. Well, if it is diagnosed during pregnancy, it can lead to certain pregnancy complications in the woman. Gestational diabetes mellitus is seen when the body cannot effectively process sugars and starches or carbohydrates, leading to high sugar levels in the bloodstream. Most women with gestational diabetes can control their blood sugar levels by following a healthy meal and also by getting regular physical activity to the necessary extent. Some women may also need insulin to keep the blood sugar levels under control. Gestational diabetes is directly linked with obesity in the offspring through adolescence. Additionally, children whose mothers had diabetes are more likely to develop type 2 diabetes themselves. Although this gestational diabetes usually resolves after pregnancy, women who have this gestational diabetes may have a higher risk of developing diabetes in a later period of time, that is in future. Then yet another problem which is much discussed and is really a cause of concern is hypertension, the high blood pressure. Chronic and poorly controlled hypertension or this high blood pressure before and during pregnancy puts a pregnant woman and her baby at risk for certain health problems. It is associated with an increased risk for maternal complications like we have seen in gestational diabetes too, like preeclampsia, placental abruption, that is where the placenta separates from the wall of the uterus, and gestational diabetes. These two are also linked. These women with high blood pressure face a higher risk of poor birth outcomes, like for example, they may have a preterm delivery, having an infant small for her gestational age, for his or her gestational age, and sometimes infant death as well if it is not controlled. Getting treatment for high blood pressure is very important before, during and after pregnancy, not only for hypertension, any health problem, any health risk that we have been talking about so far, it is very necessary that treatment be properly taken. Yet another important aspect now, other than the illnesses that we have been talking about, is the mother's diet. A mother's diet clearly plays an important role in fetal development and the mother's health as such. During pregnancy, during childbirth, an easier labor and a generally healthier baby than a mother whose diet is deficient or is restricted in nutrients. Because the embryo's or fetus nutrition is based on maternal provision of proteins, vitamins, minerals and also a total caloric intake, infants born of malnourished mothers are more likely to exhibit themselves certain malformations. A little more about this malnutrition. Is it irreversible? Can nothing be done about it? No, it's not like that. Fortunately, there are ways to counteract maternal malnutrition. Dietary supplements for mothers can reverse some of these effects that we have been talking about, some of these problems that we have been talking about, which may be produced by a poor diet. Furthermore, research also shows that babies who were malnourished as fetuses but who are subsequently raised in enriched environments can overcome some of these effects of early malnutrition. However, if we realistically look at the picture, very few of the world's children whose mothers have been malnourished before childbirth are likely to find themselves highly enriched environments after the birth in order that these deficiencies can be substituted. That is the reality. Then comes yet another factor which we need to discuss, the mother's age. More women now are giving birth at a later age in their lives, which as compared to some 2-3 decades ago, today's mother's age, in certain cases at least, is far more than what it was long back. This change is largely due to the transformations in this society, a lot of social change, as more women have now chosen to continue their education with advanced degrees and they have their careers, they want to stabilize their careers before the first child is born, and hence even the mother's age has now progressed. If you compare it with 1970s, that is decades ago, today you see more women giving birth to their first child in 30s and often during their 40s as well. However, women in higher age groups, extremely higher age groups, are at greater risk for a variety of pregnancy complications and birth complications compared to younger women. There is a greater likelihood of premature births and children with lower birth weights. By the time a woman reaches 42, in 90% of the cases, eggs are no longer as normal as they were earlier. Older mothers are also considerably more likely to give birth to children with Down syndrome. It's a form of mental retardation. However, we did also say that more and more women now are preferring to give birth to their first child only at a later age, most of them around after their 30s and some of them even after their 40s. So, does that mean there might be a problem? Well, there is a research which contradicts what we have been talking about so far, that there might be more complications, there might be more problems. For instance, there was one study which said women in 40s have not faced greater health problems compared to women in 20s. Women who become pregnant during adolescence, such pregnancies interestingly account for 20% of all pregnancies. They face such elevated health risks as compared to what we have been talking about earlier, according to the studies. They are more likely to have premature deliveries, and the mortality rate of infants who are born to adolescent mothers is twice as that for mothers who have crossed or who are in their 20s. Then yet another alarming factor which also needs to be discussed with relation to maternal health and child health is mother's usage of drugs. There is a usage of many kinds of drugs. Some of them may be legal, some of them may be illegal in some people, and such usage of drugs may pose serious risks to the unborn child. Without consulting a medical specialist, any drug which is taken has to be seriously thought of during pregnancy. Only in consultation with the medical specialist, drugs have to be used. Some studies have shown that even aspirin, which is taken for headache, and many do that without consulting doctors, can lead to fetal bleeding and growth impairments. Yet another alarming factor which might affect the health of both the mother and the child might be smoking in mothers. Smoking can have many negative consequences. For instance, it reduces the oxygen content and increases the carbon monoxide of the mother's blood, which quickly restricts the oxygen available to the fetus when she is pregnant. The end result is an increased possibility of miscarriage for the mother and a higher likelihood of death during infancy. Now, how can we complete our discussion without talking about the modern day demon, the stress? Maternal stress can affect the fetus both directly and indirectly, in addition to all these factors that we have been talking about. When a mother is under severe stress, physiological changes which occur in the body can harm the developing fetus. Yet another factor that we have to discuss and be careful about is depression. Depression which persists during pregnancy can make it hard for a woman to take care of herself as well as the unborn baby. Having depression before pregnancy is also a risk factor for postpartum depression, after delivery, the depression. Hence, getting treatment is essential, it is a must, it is very necessary for both the mother and child. Now, having talked about maternal health during pregnancy, let us now move on to talking about maternal health during childbirth as well as the period that follows, which is postpartum period. In many developing countries especially, complications of pregnancy as well as childbirth are leading causes of death among women of reproductive age. A woman dies from complications from childbirth approximately every minute. Today, high quality accessible healthcare has made maternal death a rare event in developed countries where only 1% of maternal deaths are seen. A trained provider with midwifery skills should be there at every birth. Transport should be available to referral services. Quality emergency obstetric care has to be available. This might contribute to improved rate of survival, whether it is during pregnancy or after childbirth or during postpartum condition. So let us summarize whatever we have talked today. Health of a woman during pregnancy, during childbirth, as well as in the postpartum period. It encompasses the healthcare dimensions of family planning, preconception, prenatal and postnatal care in order to reduce maternal morbidity as well as maternal mortality. Let us look at some questions in this lesson which has been discussed so far. What is the role of poverty and access to health care in maternal health during pregnancy? How does gestational diabetes contribute to pregnancy complications? What are the effects of maternal malnutrition? You can refer to books such as those by Feldman, 2010 publication, and the title is Discovering the Lifespan. It's a Pearson Education publication. You of course have Hurlock, 2010 publication once again, titled Developmental Psychology, a Lifespan Approach. It's a Tata McGraw-Hill Education Private Limited publication. Papalia, Diane, Old, Sally, Feldman are. The year of publication is 2008 and the title of the book is Human Development. It is 11th edition. And this is once again McGraw-Hill Education publication.